Can you do cardiac rehab in a person who survived a stroke? That's what Baricich is going to show us with this systematic review meta-analysis. They got 1,229 participants over multiple studies, and then they looked to see if these people actually improve or not when they get cardiac rehab. Now, I didn't get a chance to look at every one of these studies, but I'm going to assume that none of these people have moderate to severe hemiplegia. They should all be able to do bimanual tasks and do their activities of daily living. So it's not your worst strokes, it's probably your better ones, and they probably didn't have a recurrence, or maybe not a crippling recurrence. But that being said, yeah, there's improvements. So the 6-minute walk test improves. What doesn't change is the 10-minute walk test or a timed up and go test, which is a little bit tricky because if you think about what's going on, 6-minute walk test improves, so the immediate fitness improves, but the long-term fitness doesn't. They have coronary disease and they've had a stroke, so it's not really a big surprise. They have kind of a ceiling effect on how good they're gonna get. The other part is timed up and go. These guys are probably already very close to independent for their daily activities, so there wasn't much to change. They're very close to the ceiling to start with. Is this study important? Yes. Why? If a person's had a stroke and hasn't got cardiac rehab, they need it. And we don't even have that many centers across India right now actively doing it, much less for stroke survivors. So the patients need to know this. Sadly, the doctors who have these patients don't understand this or consider it. So as patients find this out, get it done, it's very possible and it's good for the rest of life.